lifestyle, with the diet, and perhaps with the supplements, right, that you are taking. So let's explore the first illness first, which is diabetes. So 1 out of 11 Americans, right, suffer from diabetes, right? 1 out of 4 people didn't realize that they have diabetes. And the economic burden with people with diabetes on the economy is $327 billion. That's a lot of money wasted on a lot of things. Healthcare, amputation, right, that leads to cardiovascular disease and can also lead to dialysis and so on. And the risk of death, people with diabetes, significantly higher, which is 50% more. So if we can prevent this, and in fact, the HSA, the Minister of Health, actually did a caption, and they say that we need to fight diabetes, right? Fight diabetes, but how do we fight it? Because, we can fight fire with water. Maybe we can fight an MMA fighter with gloves. But how do we fight diabetes, right? So let's explore how. So there's 2 types of diabetes. Number 1 is type 1 diabetes. And this particular illness, usually they call it juvenile diabetes, whereby when they're young, they're being infected by a virus called Coxsackie virus. And this particular virus is attacking the pancreas, especially the beta cells, which is the insulin production of the body. And the insulin that is manufactured is mutated, which is not usable. So that's the reason why they call it type 1 diabetes or juvenile diabetes. But as adults, we develop diabetes, right? We develop diabetes, and more commonly, most of us will get the type 2, right? Not type 1. So, and it's also called insulin resistance. Now, how do you define as insulin resistance? So, this is how your cells look like. And insulin acts like a key. So without the insulin, the glucose that you ingested, right, from rice, from pasta, from bread, from your roti prata, will not go into your cells, right? So only when the insulin is there, right, can see. Right. There's an interruption. So only when you have the insulin can open the key to the gate to your cells so that your glucose can enter your cells and produce energy. And that's how we get energy, from glucose, right? Or any other sugar. Okay, so this is, so like what I say, there's 2 types, right? Diabetes type 1, destruction of beta cells. The insulin manufactured is deformed, is mutated, and you cannot use it. But type 2 diabetes, right? You have insulin, right? You have insulin, and so insulin. So insulin, after the, it's like this. Let's say I have not met Ramesh for a long time, and all of a sudden we met again. And then I say, hey, Ramesh, where do you stay? Oh, Ramesh he stays in Pasir Ris. Oh, okay, I'll see you tomorrow. Huh? So tomorrow, after he gave me his address, 8:30 in the morning, I will come over, and I bought, let's say, a bundle of pratas, and we eat. So lunchtime, right, I pop in again. I say, hey, Ramesh, I brought another packet of noodles. Let's eat. And then dinner time, I also come over to his house. I brought something. And supper, right, I brought some other thing. And the next day, the same thing happened. Guess what Ramesh will do to me? He will not open up his door, right? He had enough of me. Once in a while, it's okay. But too often, too long, he gets tired of me. So that's the same thing in our body also. In today's world, we have abundance of food, right? We have too much food. So in the past, food rarely comes by, right? You have to dig up a tuber and then you ingest it and you get some glucose out of it. Or you met some bushes where you have some berries and then you ingest the berries and then you get some glucose from it. But today, as long as you have a couple of dollars, right, you can enjoy a lot of sugar, a lot of carbs. So today's world, we have a low amount of carbohydrate, and our body cannot actually metabolize it. So the body gate, which is the insulin receptor, shut off, right? And that's the reason why it is called insulin resistance. Okay, it is not about. Sometimes I saw doctors, and then I have friends who are functional doctors. They are disagreeable with one another. They don't believe that the treatment is correct, whereby you give more insulin, right, to the patient, so that the body can. The body has too much insulin, in fact, when you're type 2 diabetes. So, so as you can see here, the definition of insulin resistance. Insulin resistance is defined as the failure of the target organs to respond normally to an action of insulin, right? So your body don't respond to insulin that well. And that's the reason why a lot of people are going keto. Because when you are into keto, the ketones, you don't require insulin, right? When you are in the high fat, high protein diet, right, your body doesn't require that much of insulin. All right. So that's the reason why there's a lot of growing trend. And even I just came back. When I came back from Indonesia, surprisingly, there are a lot of restaurants which is going keto, right, in Indonesia. So the history of insulin resistance is not new. It's discovered, right, way back in 1889 by a German scientist called Minkowski and von Mering. So finally, it's not really confirmed, but about 40 years later, Professor William Falta in 1931 confirmed that it's true. So this concept of insulin resistance is not new. It's not something that, invented by or discovered recently. So it's actually discovered a long time ago. So the vicious cycle of insulin resistance, when you eat food, right? When you feel hungry, you eat food and your body starts to produce insulin, but your cells resist insulin. And then the sugar is stored as fat, and you're still hungry, and then you decide to eat more food, and then you're consistently hungry, you're consistently thirsty, and this is the vicious cycle of insulin resistance. All right. So if you are insulin resistant, you would see that you generally can develop fat, especially in the abdomen area, right? As they call it, central obesity. Hypertension can follow suit, right? Atherosclerosis, that means hardening of the arteries, also can accompany. And you have other things such as hyperinsulinemia. That means your insulin is way off the roof, right? So this is all the symptoms of insulin resistant. So when you are insulin resistant, also you have blurred vision. Just now I have a lady, she called me, she said, after I eat rice and all that, I had this blurred vision, but I don't eat rice, I'm okay, right? So I'm telling her that you're already developing, you're already pre-diabetic, right? So check your HbA1c. So if you're consistently thirsty, if you urinate frequently at night, and you are not a male above 50, right? If you're a male above 50, you might have prostate cancer or prostate enlargement. That's a different thing. You also urinate at night. But if you always thirsty and you urinate very often, and the worst thing is that you see a lot of ants, at the urinal area, that's a good sign that you're already diabetic. So let's look at how you detect whether you're diabetic or not. Number one, they call it the this is my favorite, which is the HB1AC. Right? So HB1AC, if you're below 5.7, that means you're normal. Right? I am about 5.6, 5.5 normally, which is I'm always normal. But if let's say I don't take care of my food and I overeat, I frequently eat and all that, I might develop pre-diabetes, which is like 5.7 and above to 6.4. And then if you go to the doctor already warned you that diabetes is coming. So anything which is above 6.5, right? 6.5, you're already classified as diabetic. Right? You're already classified as diabetic. So out of this fasting blood sugar test and glucose tolerance test, I prefer HB1AC. Now, where do you measure HB1AC? You can visit your regular doctor, or you can go to Kallang Pudding, and you can go to Kallang Pudding, and you can go to Alpha Building, and there's a center called PathLab. So PathLab is where all the doctors and clinics and hospitals send their blood samples there for checkups. You can go there and get a discount, right? And you don't need to pay a consultancy for doctors. But down there, the one that is checking your blood, he himself is a doctor. So you can ask him a few questions, and he is willingly going to give you tips, right? Going to give you free consultancy. So measure your HB1AC regularly, 6 months once at least, if you don't have any symptoms. But if you have already the symptoms, measure it immediately, and 3 months once you can measure it again. So as you can see here, right, the HB1AC, that means this is glycation. Glycation means, for example, you take sugar, white sugar, and you heat a frying pan. You don't put anything, you just put the sugar onto the frying pan, and the sugar melted, and after a while it caramelizes, and then it burns, and then it sticks onto the pan. So this is exactly the same thing that's happening into our cells, whereby glucose or sugar is glycated to the protein in our cells. So this is, we call it glycated or HB1AC, right? Glycation happens when you have too much sugar in your blood. All right, so when you have blood sugar levels above 6.5, you have normally you go to the doctor. Doctor will give you monotherapy. That means a single drug, which is normally metformin. And then if you, after 3 months or 6 months, they measure your HB1AC, and it goes up again, and then they will give you dual therapy. And then if, let's say, your blood sugar level goes higher, right, and then they will give you triple therapy. And then if it doesn't work, then they will give you insulin injection, right? So, but this is a picture that I took when I studied in Stanford Medical School, and but in this course that I took, it shows that you can actually reverse it, because if, let's say, you are taking triple therapy, and if you manage to bring down your HB1AC, the doctor is obligated to take one out of your 3 drugs that you are taking. And if you go lower again, right, the doctor will have to reduce it from 2 to 1, right? And then eventually, when you are below 5.7, your HB1AC, you don't need to take any drugs actually. So the key thing is this: it is reversible. Who says that, right? Top schools like Stanford Medical School, right? And also, I took another course from Harvard Medical School. They also say that it's reversible, right? So diabetes is actually reversible. Right? It takes time, it takes effort. Surely it is reversible. So as you can see here, right, the effects of metabolic syndrome and prediabetes include dry patches on skin and groin, right, which is dark. That's why they call it acanthosis nigricans. High blood pressure, heart disease, frequent urination, excessive thirst. You can drink 2-3 bottles of water, you still thirsty, and that's the reason why they call it pre-diabetes. And easy for people to gain weight. Some people who have high metabolism or they're not diabetic at all, they can eat a lot and then they still can maintain their weight. But people who are like pre-diabetes or even diabetic, sometimes they stare at the chocolate cake, they gain a few pounds. They do not know where it came from. So who are people who are at risk of insulin resistance? People who are above 40, right? That's one. Number two, BMI, body mass index above 25. But I'm sure Ramesh BMI is higher than 25, but he's certainly not diabetic. He trains every day, right? And he goes to the gym frequently, and he plays badminton twice a week. And he can't be diabetic because he has, although he's not obese, but his BMI is definitely above 25. So BMI is not a very good measure of whether you're obese or not, right? And if you are a man, your waist size is above 40, right? Which is bad. If you're a woman, your waist size is above 35, which is really bad. And of course, if you have family history of diabetes, that predispose you of getting diabetes also. And then the last one is that you have a sedentary lifestyle. Okay. Now let's skip all this and let's look at what we can do to combat or to fight diabetes. So these are the steps that you can do. First of all, aspire to have weight loss. Right? So I went to the gym when I was studying abroad, and then I came back. I joined the same gym, and then it's a new year. So I after I finished graduating, and then I came back, so I decided to join the gym somewhere in December. And when the new year came, the gym was packed. So the gym instructor or the gym administrator, I came to her, I said, Mary, I think I better get my money back. There's no point for me to join this gym, it's too crowded. She says, Zul, take your bag, relax, come back in about 2 weeks later, you will see the gym is empty back again. I said, how do you know? I said, I've been a gym trainer for many years, I know. This is a New Year's resolution, right? New Year's resolution doesn't work. So a lot of people will say, okay, next year I'm going to look like, Tom Cruise, six-pack and so on. That doesn't work. But what you can do is that you can aspire to lose, let's say, a maximum a kilo a week, right? Using exercise. The best form of exercise would be probably HIIT, right? Second best is that you measure your heart rate, which is the fat burning zone, heart rate. That's the second best. And then, of course, normal cardio is also somehow good, right? So when I want to lose weight to compete for karate, I have to lose about 15 kilos. And so I time myself, 1 week I have to lose a kilo. And I go to the stepper machine and the treadmill, and I start to sweat it out. So I aspire to lose 1 kilo a week. And of course, I managed to achieve my goal. And then eventually, my karate instructor sent me to compete in the World Karate Championship. So don't have hazy goals in terms of weight loss. Have definitive goals. If you cannot lose too much weight, cannot diet so much, what you should do is that you should say that I want to lose half a kilo a week. But consistently, if you can lose half a kilo a week, I'm sure you will get to wherever you want, right? So the next one I just mentioned is exercise. And then the last one is diet. Okay, this is a good course that I encourage everybody to take, right? You can take it even though you're not a doctor, right? Or if you're not a PhD, you still can take up this course. It informs you about lifestyle changes and how nutrition and what do you call that? Nutrition and metabolic syndrome is related. Okay, avoid sad diet and the American diet, right? Sorry, sad diet is the standard American diet, right? Loaded with carbohydrate, such as donuts and French fries and burgers and so on. And crab diet is carbohydrate that have been refined and processed, so they call it crab diet. So avoid sad diet and crab diet. So what should be your diet be? Your diet should be more fruit, FOOD, right? Fruits and veggie, right? Number 2, organic lean protein. Third one, have omega-3 fatty acid if you're not eating enough fish. Make sure that you have omega-3 because you need omega-3 to burn fat. And then the last one is drink plenty of water. Okay, this chart is very interesting. They notice that if you activate CYP1 genes, you have these genes. All of us have these genes, but you can activate it. You have to activate it. So you can activate it using calorie restriction. That means minimum you have to skip one of your 3 meals. You cannot have like, calorie restriction. That means, you're going to avoid that small little cherry on top of the milkshake. No, it's not good enough. You have to avoid one of your 3 meals. That means you go into 2 meals instead of 3. Next one, you have to really exercise, right? Not, you just chase the bus and you're late for work and you say, hey, I just exercised just now. That doesn't count. Huh? You must really sweat it out, right? And then the last one is, you probably have seen this before. It is called resveratrol, popularized by a man called Dr. David Sinclair, right? Dr. David Sinclair is a Harvard professor, and he advocates people to take resveratrol. What happens if you take resveratrol? You would extend your lifespan by 30% and extend your health span, right? Health span is a number of years that you have in this world that you are not sick, right? So let's say you live to 80 years old, but 10 years you have been bedridden and you've been sick, you will need someone to attend to you. That means you have a health span of 70 years and a sickness span of 30 years. So by taking resveratrol, you activate these CYP1 genes, you see your metabolic syndrome will start to go away. Number 2, your cardiovascular is improved. And then your mitochondria dysfunction might return back to normal. And then the last one, neurological disorder can also come back to normal. So there are many studies done, endless. I just show you 2 on resveratrol. So resveratrol is a compound from grape skin, and the French consume it. So they call it the French paradox because the French eat a lot of food, a lot of fat, a lot of carbs, but they seems to be the healthiest European in the world, right? They eat more fat than the Nordic people. Imagine that. And when I was there, they eat a lot of croissant. They eat for 2 hours for lunch, but then they have this wine. The grape wine has resveratrol, and that helps the French people to ward off sickness such as diabetes, cardiovascular disease, and even cancer. So resveratrol is truly a miracle molecule. And you can see here also, right, which is T2DM. It helps to reduce type 2 diabetes. Okay, let's see what we have here. Astaxanthin. Astaxanthin, I would say that it's more powerful than resveratrol, right? Many studies have shown that it can also alleviate diabetes type 2. Let's see what other compound. As you can see here, astaxanthin not only activates sirtuin-1 gene, but also FOXO3 gene and NRF2 genes, right? So, and it activates a kind of enzyme that helps your performance of your mitochondria better than normal. So we're going to the Q&A session. If you'd like to ask me or Ramesh any question, we are very pleased to help you. All right. So probably you were saying that, where can I get all this beautiful compound? So what I do is that I formulate HL span, and HL span consists of the compounds that prevents and actually switch on your good genes such as sirtuin-1 and NRF2 genes and FOXO3 genes. And this is our signature product, right? And, if you buy astaxanthin alone, it can cost you between $40 to $50.
Dr. Zul,
yeah.
Sorry, could you exit the sharing part?
Okay.
So we can see everybody, and you can also show your HL span.
Oh, okay. Oh, yeah, I didn't exit.
Yeah.
Mm-hmm. Okay. All right. Okay, so this is our signature product, and a lot of people simply love it. It's the most expensive product in our product line, but it's the most sellable, right? And people keep on coming back for more. So inside, we put in at least 5 compounds that is beneficial for people suffering from diabetes and to prevent diabetes. And resveratrol, like what we mentioned, is inside. 500 milligrams of resveratrol, which is recommended by Dr. David Sinclair. And we also put in astaxanthin, right, which is effective dose. A lot of companies are putting astaxanthin, but because it's an expensive compound, only found in Hawaii, so a lot of people are putting much lesser, right? Our competitor, I don't want to mention their name, they're only putting 0.176 milligram, and we are putting it at least 20 times more. Sorry, 200 times more, right? So the next compound that I'm so excited that helps to repair the nerve of people who have diabetes. They have neuropathy. Yeah? That means their nerve starts to fray. They call it their myelin sheath. The myelin sheath, that the nerve insulation has actually frayed. And our product contains luteolin. Luteolin helps to repair the nerve. Right? That's the good thing about our product. We cover all angles. And our H-stasis also prevents diabetes. We have a few compounds that prevents diabetes, such as chromium picolinate. We have biotin, and also we have a special vitamin which is called bephotamine, which is a fat-soluble vitamin B1. Most companies are only putting thiamine. Thiamine is good, but when you really have neuropathy, you need bephotamine to repair your nerve. So normally they don't put it inside their multivitamin. However, we put it inside our multivitamin to help to repair the nerve of individual who suffer from diabetic neuropathy, right? Okay, so let's begin the Q&A.
All right. Thank you, Dr. Zul, for the lovely presentation. And we have gotten a lot of information from the presentation itself. Earlier on, when you mentioned about the medication that is being used for diabetic patient. You mentioned about metformin, and
Yes.
we all also know that metformin causes heart disease, and of course the numbers of adverse effect or side effects from metformin itself, I've just checked, it counts more than 13 ways of getting the side effects. So, and we all know, you and I believe that a lot of people inside these Zoom presentations also knows that prescription drugs comes with side effects. And I believe that the supplementations that you have created is good enough. And there is research done that supplementation doesn't cause side effects as well. Yeah.
Maybe we can get people who are diabetic before and they took our product and then they get better. Anybody can volunteer. I saw Emma Ping just now. I saw her name. Is she around?
She was inside.
Yeah,
Earlier.
Emma is inside earlier. She came in.
It dropped out.
So Emma was a diabetic patient, I believe,
Yes,
and
she
she's no longer a diabetic patient.
She was a diabetic.
So she had diabetic, she had gout, and she was on a wheelchair before, and now she is no longer on a wheelchair, and she doesn't have diabetic. And her twin sister, Emma Ping, twin sister, she was a diabetic, and they amputated both her legs, and later on she died due to cancer. And I believe the stress that she has gone through is too much, and she passed away as well. So it's a very sad thing that is happening around the world and to our loved ones, of not taking care of their health, and by not understanding how the body can heal when we provide the body with the right nutrients. Ima Ping is not inside here to share her testimonial, so I just shared on behalf of her. If anybody else who have any questions, can just let us know here.
I tell you about Ima Ping.
So Asma said, I did my blood test, my diabetic sugar level was 8.1. Yeah, that's pretty high. Yeah, Asma. When did you do this, Asma? When was your test done? Last Saturday. Okay. So what did the doctor say? You can unmute and talk. It's okay.
I'll be seeing the doctor. Hi everyone, good evening. I'll be seeing the doctor on the 27th of May, coming May. Because what happened was I skipped my medication because of fasting month, and that's how I think the sugar level went up. But I was taking actually the supplements. I think, I don't know what happened actually. Or maybe the last week before my test, I forgot about it. I ate a lot of sugary stuff and so, and you know.
Yeah. You see, Asma, one thing you have to remember that supplements or even medication are not miracle drugs. So when you take supplementation and all that, you must remember to avoid sugar. And then today we are very fortunate because last time the sugar replacement substances are quite harmful. But today we have stevia, we have xylitol. These are the things that you can add into your coffee or your sugar, and you can reduce the amount of sugar, you know. And of course, after Hari Raya, I think you decide to test all the nice kuih and all that. That will definitely increase your HB1AC.
Yeah.
So just keep on taking the supplements and then control your diet and perhaps do light exercise. I got a friend, his name is Dr. Karim. He was diabetic. His sister is also diabetic. And he's so bad, his diabetes, that actually one day he was walking and he collapses. And then he had to get his wife to pick him up. But after taking our product, and he can walk without getting very tired. And his sister, in fact, walked the entire East Coast to and fro. And the sister is already 78 years old. So we have seen a lot of people improve their health, but don't treat our supplement as a miracle product. Oh, I take DWA supplements. I can take anything I want. And that is not the wrong concept of getting back to your health. You still have to look into your health, your diet, and your lifestyle. Right? If let's say I give Ramesh, Ramesh actively goes to the gym and all that, but he eats a pound of kesari every day. Even though he take our supplement, he can also develop diabetes. Right? Right? So you should know what you're putting into your mouth. So control your diet and your especially carbohydrate intake.
Yeah, we hope that answers your question, Asma. Yeah, we are what we eat. That's for sure.
Yeah, Ramesh, can I?
Yes, Bang Moni, Ken.
Yeah, thank you for giving me the opportunity to pose my questions to Dr. Zul. Yeah, Dr. Zul, just now you responded to Asma's questions. Yeah, I just want to ask whether consuming coffee at the same time could have negated the effectiveness of DWA's product. Thank you.
Well, when I learned herbs and all herbalists, whether you are Ayurvedic or TCM, Western doctors and all that, they actually prohibit you of taking coffee and even tea when you're taking herbs. But I think coffee is diuretic, and coffee also eliminates a lot of vitamins, especially vitamin B, out from your body. So it depletes the vitamin. So it's like you're taking HTCs, but you're taking coffee. The next thing you see that your stasis is out through your urine. And then it's a waste of money. So when I study homeopathy, my professor Hamim told me, you want to get better, avoid coffee. I say, what's wrong with coffee? Coffee is good, right? Yeah, in the newspaper and all that, you would probably hear good things about coffee because, the coffee association, all that, they will probably tell the world that the coffee is good. But if you look into PubMed, you will see that coffee actually reduces vitamin. It stops the absorption of vitamins. It excretes vitamins. It raises homocysteine, raises inflammation in the body. So there's nothing good about coffee. But if tonight some psychic is telling me that I'm going to be robbed, right? There's thieves that are going to enter my house. Probably tonight I'm going to take coffee. But most likely I will not take coffee. Yeah. Okay.
All right. So, ladies and gentlemen, thank you for your participation. We hope that we have answered all your questions, and we hope that we have gotten a valuable information from this presentation. With that, there's no more questions. That I checked the chat. There's no more questions. So, we hope everybody have a very good evening. Yep. Thank you so much for participating in the Zoom webinar. Thank you, Dr. Zul.
Thank you, Amish, and see all of you again next time. Bye-bye.
Thank you. Good night, everyone.